Well, let's get to Aliyu, Dr. Aliyu Sokomba, who is the President, National Association of Resident Doctors. He joins us from our studios in Abuja. Good morning, and thank you for joining us today. All of these restrictions that have been announced, the measures put in place, how it will be internalized by states. What's the thinking about doctors, for instance? How do they relate with this?
Thank you very much. Good morning, Nigerians. Well, so far, we, as doctors and healthcare providers handling the cases of COVID-19 in Nigeria, have continued to contend with the reality. And as the cases continue to rise and the testing for these cases continue to increase from the various stakeholders putting more effort into containing the disease, we think several measures that are currently in place are measures in the right direction, and very soon we are hoping that this disease will be contained.
Do you see the impact of all of this in terms of the treatments, the number of people that need to be attended to, the traffic, really, of patients?
Yes. Before now, we were slow at handling these situations, but with the improved efforts from government officials, we are optimistic that we are in the right direction, and this will be curtailed in the shortest possible time.
Okay, so, yeah.
So now, with all of these conversations that have been going on, I mean, we know that to a large extent your association has been complaining about whether or not the federal government has been paying enough attention to the things that you need to get the job done in the fight against COVID-19. How compliant would you say government has been with your association or with your members at the federal and state levels in that?
Well, unfortunately, the Association of Resident Doctors just issued a 14 days ultimatum to the federal government to address some of our plights and concern, failure of which the association shall be proceeding on a total national and indefinite industrial action from 15th of June this year. And this is in response to the government insensitivity to some of our plights and concern. To start with,
hello, Dr. Sokomba, just one moment. That's not the question I'm asking yet. We're going to go to that one. But I'm saying, since the last time you came here, you've raised some issues about the provision of personal protective equipment. Are you saying that there has been no communication about that with you, with your association, with your members between then and now?
That's basically what I'm saying, that the situation has not improved. It has worsened instead, and that has informed our decision to take further action on it.
I don't understand. You're saying that even after the conversations you began, according to you, you said the federal government was talking with you about provision of these equipment. Are you saying that nothing has happened over time?
Well, over time, some treatment centers received the personal protective equipment they needed to work with. But my concern is not just for treatment center. I'm concerned about all the hospitals in Nigeria, because as I have continued to mention, that these COVID-19 patients do not have it written on their forehead that they are COVID-19. And so all patients are considered potential COVID-19 cases until proven otherwise. And until these personal protective equipment are available in all our hospitals, we'll continue to clamor for their availability. And up to this moment, that is not the case. We still don't have this personal protective equipment in most of our hospitals in Nigeria. They are readily available in treatment centers, but not in the various hospitals where patients are attended to in Nigeria.
Are you talking about hospitals that are under the federal government or hospitals under the state governments?
I am talking about all the hospitals, both in federal government and state governments.
We also have there is this information out there on the streets that some of your members had conversations with a government in the southwest, Ogun State in particular, and that the Ogun State government have spoken with them and said, you know what, we're going to increase your hazard allowances between 200 and 300% of what they were currently having, yet they still decided to go on a 3-day warning strike. Are you aware of that, and what was it about?
Thank you very much. The governor of Ogun State has not been sincere with his claim, and I must say categorically that there has not been any understanding between the governor of Ogun State and the resident doctors in the states. There has been several clamor by the doctors in OOUTH teaching hospital with regards to their welfare and their well-being in that hospital, and we have not been informed. There has not been any memorandum of understanding signed contrary to the claim by the governor. I don't know if he has plans of getting that done soonest, but up to this moment, that has not been done.
Has there been any conversation between your members? Have there been any conversation between your members and the Ogun State government?
Yes, there has been several engagements, but no memorandum of understanding was signed, and that was what our members were clamoring for, so that whatever agreements that is reached will be legally binding and will be executed, but that has not been done up to this moment.
Right, so let's talk about the 14-day ultimatum which you have given, and you say that if your demands are not met, then you will proceed on a strike. A lot of people are handling that differently, especially now that we're facing a pandemic and we're trying to flatten that curve and ensure it dips. And we know the role that your members play in ensuring that we achieve success in that area. You have talked about equipping, hospitals with PPEs. What are the demands are you bringing to the table?
Well, basically, we are asking that some injustice that are meted against our members be addressed. I want to start by informing you that sometimes in 2017, the National Assembly enacted the Medical Residency Training Act to govern residency training in Nigeria. Since 2017 up till 2019, that act was never implemented. We raised some concern which led to the intervention of the Right Honorable Speaker, and we were promised that from 2020 January, that Medical Residency Training Act will be implemented. And just as 2020 came up, the punitive part of the Medical Residency Training Act that stipulates that anybody that is unable to finish their program in good time should be exited, that was implemented. And because it was implemented in line with the provisions of the Act, we had no objection to that. We only clamored that the funding of the program should also be commenced so that we'll have the full implementation of the Medical Residency Training Act. As if that was not bad enough, the Chief Medical Director of Jos University Teaching Hospital proceeded to disengage resident doctors this time around without recourse to the provisions of the Medical Residency Training Act. We brought that to the attention of the Board of Management of the Jos University Teaching Hospital as well as the Supervising Ministry. 3 months after those residents were lawlessly, illegitimately disengaged, up to this moment, nothing has happened. Of the 26 resident doctors that were sacked, only 2 resident doctors actually deserve to be sacked based on the provisions of the law. And we have stated categorically that we have nothing against people being asked to leave the program as long as it is done in line with the provisions of the law. And we continue to wonder how the National Assembly will go through all the trouble of enacting a law. The president of the country will go through the trouble of signing it into an act for one chief medical director to shun and disregard. The chief medical director has disregarded the act of the Parliament of the Federal Republic of Nigeria, and we consider it the height of impunity, the height of administrative rascality, and we're calling that the Chief Medical Director rescind on his decision to illegitimately disregard doctors without recourse to the Medical Residency Training Act. Secondly, the government of the day had on several occasions announced to the world their decision to implement and review the hazard allowance of healthcare workers. I am sure you are quite aware that on several occasions, including the President of the Federal Republic of Nigeria, has announced the review of the hazard allowance, as well as the plan to pay the inducement allowance for COVID-19. Up to this moment that we speak, that has not seen the light of the day, and we have it on good authority that the government have no plan of seeing to the end of that agreement they willingly and freely reached with union leaders. If that agreement was reached freely, we believe upon their honor, they should see to the implementation of that agreement that was reached with us.
Just hang on a minute. About that, thirdly, the Jos University Teaching Hospital matter, we got some preliminary word from the medical director who says that is not the situation. But we'll try and get to hear from him directly to hear what really happened, because the views he expressed at the time were different from what you're saying. He was saying some of them have finished their project and they were on their way out, so he doesn't understand some of this. But until we get to hear from him, you know, in terms of what really transpired, maybe we can revisit that matter. But part of your demand, which was circulated, reported in the media, is that you were asking that security agencies stop harassing including doctors at that time. But we also do remember that the NMA, for instance, in Lagos, they did declare a strike, and then they called it off because the Lagos State government and the police had spoken to all of those. So haven't you been spoken to by security agencies at the moment on that matter?
The harassment of healthcare workers has continued to be a challenge. Not all this harassment gets to be reported to the media. And you are quite aware that on 2 occasions, doctors in Lagos State were harassed. Doctors were harassed in Akwa Ibom State. Doctors were harassed here in Abuja. And doctors' harassment has continued to be a challenge for us. Yeah. And in most cases, this harassment don't get to the media. And so we are calling on the security agencies to desist from harassing these healthcare workers.
Dr. Sokoba, I understand that point. In addition, what I'm asking is, the police themselves put up a statement that even the NMA put up a statement that they had been reached out to by the Nigerian police at that time, because this, correct me if I'm wrong, it came up stronger during the time of the lockdown, where even those on essential services, including doctors, were being harassed. Have you been spoken to? Do you have any communication from the police? Because the NMA had that they called off the strike.
Yes. The members of NMA that were harassed, incidentally, are also our members. So we have been communicated on that. But what we are saying is that the communication has not led to the complete stoppage of the harassment. So we are calling on the security agencies to completely desist from further harassment, because it also has been reported of incidents where doctors were arrested and detained. So these are recurring incidents that we want to completely stop. Okay. And that's why we capture it as part of the demands in our communique. And we also captured the other aspects of state governments.
Just hold on a minute. About the PPEs that you requested, because clearly you're not on the same page with the NMA on that particular matter, since it's still part of your demands for a strike. What do you want with the PPEs? Are you asking government to provide to all hospitals, or what?
Well, basically, we shouldn't even be asking governments to ensure the availability of personal protective equipment in our hospitals. That should be something government does spontaneously. But because these personal protective equipment are not available, it has continued to expose our members to unnecessary risk. As I speak to you, 72 hours ago, I lost one of my members in person of Dr. Nasir Adam in Birni Kudu, again to COVID-19. So we are continuing to receive these news of the death of our members, most cases as a result of inadequacy of personal protective equipment in the various hospitals where they work. And this problem has continued to exist as a challenge, and we want this challenge addressed. We want personal protective equipment available in all hospitals where doctors see patients. That's
if the government
demand we want the government to attend to.
If the government is to provide that, just hang on a minute. If you want the government to provide that in all the hospitals, remember that, number one, it's not all hospitals that are designated to treat COVID-19 cases. We understand that patients accidentally may present themselves in some of the hospitals for other matters and may have COVID. But what is the role then of hospital owners if their hospitals are not designated to treat COVID? Should government also be providing for them as well?
Well, I'm talking about government institutions. Government should be the owner of all institutions as governments. I'm talking about the state government institutions as well as the federal government institutions. I want them to, being the owners of this hospital, ensure that these personal protective equipment are available to all the hospitals, because as we are already contending with the community transmission of this disease, any patient that presents to any hospital is considered a COVID-19 patient until treated or until proven otherwise.
Okay. Yesterday, the Minister of Health did say that the Ministry of Labor is already in communication with NARD. Is that correct?
That is not correct. Unfortunately, we have not even been contacted, let alone a meeting being scheduled, let alone us having a meeting. So that is absolutely not correct. But I also want to state here that in addition to federal government addressing some of our challenges, we also have some issues with some state governments, like the state governor of Kaduna State, who slashed the salaries of doctors and other health care workers by 25%. And we consider this highly callous, and we want that reversed, because that was not done willingly and voluntarily. And I think it is criminal to take somebody's hard-earned money for whatever purpose. We want that reversed. We also have situations in Kogi State and Calabar, in Cross River State, that have refused to test their people, thereby exposing our doctors to unnecessary risk in these hospitals. And we also have situations in states like Gombe State, states like Abia State, Imo State, Ogun State, and Oyo State, for not
if you can hear me, Dr. Sokomba,
to terms and agreements they reach with healthcare workers.
Right. Now, I'd like to quickly take a quote from the Minister of Health, saying that as we speak, negotiation is going on with the Minister of Labor. The Permanent Secretary of the Ministry of Health is representing us there. And he went on to appeal to resident doctors not to, go on strike. But he also said that his office is always open, and you can call up or write to discuss these issues at the ministerial level before it gets to the public level, to use all avenues of collaboration. The question now is, have you reached out?
Thank you very much. On the issue of disengaged doctors of Jos University Teaching Hospital, we wrote 2 correspondences to the Federal Ministry of Health, of which a response was sent to us. And in the response, it was stated that the matter is being addressed by the Board of Management of Jos University Teaching Hospital, and we were warned in that correspondence to desist from further disturbing the ministry with issues like
that. That was actually supposed to be for from the Ministry of Health.
Should be referred to.
Okay, well, he was actually referring to the Minister of Health
hospital
and the negotiation with Ministry of Labor, but we unfortunately have run out of time on this one. But we'll follow up on some of these cases with some of the relevant bodies that you've mentioned. We do thank you for coming on this morning, Dr. Aliyu Sokomba, President, Nigerian Association of Resident Doctors. We're back in a moment. Don't go away.